So body contouring is getting very, very popular, and the answer is very simple. People are able to lose weight much easier today than they were 20 years ago. We have things like weight loss surgery, such as gastric sleeve. We have things like Ozempic and other medications that are allowing people to lose weight at a much better rate. And what happens when you lose weight? You oftentimes get loose skin. It's the same phenomenon that women have after pregnancy, where they get a bit of loose skin on their tummy after having children. Same thing applies when you gain weight and lose it. So hence, body contouring has become very, very popular. So body contouring can include things like just standard tummy tucks, which are very, very popular, but it also can include other surgeries which some people may not know about, but actually give great results. I do a lot of arm lifts where people will get excess skin draping on the upper arm. They call them the so-called bat wings. But it's very easy to tailor up that skin, remove the skin to give a very normal contour of the arm, and in exchange you get a very fine scar that can be actually quite hard to see. Outside of arm lifts, I do a lot of thigh lifts. Same principle applies. If you gain weight and have larger thighs and you lose that weight, the fat tissue will be gone, but not necessarily all of the skin. So there are a couple methods for doing thigh lifts. Some are more subtle, where we make incisions along the bikini line to pull that up. We have larger operations which can really almost recontour the entire medial thigh area. So body contouring has become very, very popular. I would say across the board, patients are very happy with the results. Part of that is really talking with patients and making sure that they understand what they're getting, making sure they understand the limitations and the expectations of the results of these surgeries. But I found that if you educate patients and they are good candidates for these, you can get patients that are very, very happy with getting body contouring procedures. Generally, the biggest risk of those surgeries is the incision going to heal perfectly or not? And for me, overwhelmingly, the patients do heal great. But sometimes, depending on different risk factors, like, is a person diabetic? Are they a smoker? There are potential risks for body contouring. So it's important that if you go for consult for body contouring, that your surgeon takes the time to ask you all the questions to find out, are you a candidate who is going to sail through this, or are you one who might be potentially more prone to problems? So it all comes down to having a good doctor-patient relationship to find out the answers to those questions.